Video knowledge. We learn, we shoot, we show. Introduction to clinical pharmacology. Hello everyone. Today we will discuss a very important topic in the field of medicine, clinical pharmacology. Throughout this lecture, we will review the basic principles of studying drugs, understand key concepts, and examine the effects of medications on the human body. Part 1. Basic principles for studying drugs. First, when you start learning about drugs, it is important to focus on drug families rather than individual drugs. For example, there are many medications that fall into groups such as antiepileptics or opioids. Common suffixes. Familiarize yourself with common suffixes of drugs such as olol, statin, opril, and EPAM. Primary uses. Learn about the clinical applications of the drugs and their implications. Key side effects. Most side effects stem from the mechanism of action of the drug, so you shouldn't need to memorize them, except for idiosyncratic side effects. Part 2. Mechanisms of action. Next, we will learn about the mechanisms of action for different drug groups. At the cellular level, understand how the drug acts on specific cells and what its effects are. At the physiological level, examine how cellular effects influence the body's physiology, as seen with amlodipine, which is a calcium channel blocker at the cellular level and affects blood pressure at the physiological level. Part 3. General therapeutic principles. Instead of focusing on specific drugs, it is important to understand the general therapeutic principles for certain diseases. Heart failure, treated with ACE inhibitors, beta blockers, and diuretics. Asthma, treated with bronchodilators, corticosteroids, inhaled, and novel drugs like montelukast. Part 4. Clinical therapeutic guidelines. Learning specific clinical therapeutic guidelines is important, but it's advisable to save that for clinical practice. Therapeutic guidelines change frequently, so it's essential to check the most up-to-date guidelines when treating patients. Part 5. Key concepts. Let's go over some key concepts. Pharmacodynamics describes a drug's effect on the body at the receptor level, including efficacy, potency, agonism, and antagonism. Pharmacokinetics describes the relationship between drug administration, rate of absorption, distribution, and elimination from the body. Part 6. Quality use of medicines. When considering drug therapy, it's important to evaluate beneficial and harmful effects. What benefits does the drug provide compared to its side effects? Cost-benefit analysis. What is the risk of treatment versus the risk associated with non-treatment? Part 7. Evidence-based medicine. Evidence-based medicine emphasizes the integration of clinical expertise with the best evidence from systematic research. This includes multiple phases of drug testing before widespread adoption. Part 8. Traditional medicine versus Western medicine. To conclude, we will discuss the differences between traditional medicine and Western medicine. Generally, Western medicine is considered more effective due to purity of the active compound, accurate dosage and concentration, knowledge of toxicity. However, some people prefer traditional medicine based on the belief that natural means safer. It is important to remember that all active substances can be dangerous if not used correctly. Conclusion. Clinical pharmacology is a broad and complex field, but a deep understanding of the basic principles will allow us to provide better care for our patients. In the next video, we will discuss pharmacokinetics in depth. Thank you for your attention, and I hope this lecture has been helpful.